Today we will be talking about trauma-focused cognitive behavioral therapy with a guest feature, Yahaira Marquez. What is trauma-focused cognitive behavioral therapy? TF-CBT is an evidence-based hybrid approach that aims to treat children and adolescents who have experienced trauma along with their parents or caregivers. Trauma, as defined by the Center for Addiction and Mental Health, is the lasting emotional response that often results from living through a distressing event. Experiencing a traumatic event can harm a person's sense of safety, sense of self, and ability to regulate emotions and navigate relationships. TF-CBT integrates a variety of interventions and therapies. We have seen TF-CBT's effectiveness in over 50 scientific studies, including 22 randomized trials. Results have shown that compared to other treatment methods, children get better and get better faster when undergoing TF-CBT. It effectively addresses symptoms of PTSD, depression, and feelings of shame. One of the main findings is that parental or caregiver involvement is very beneficial. It is important to note that support from the non-offending parent is part of the healing process. Now, we are going to hear more from Yahaira Marquez, a psychologist and associate professor at the CARES Institute at Rowan University School of Osteopathic Medicine.
The process of therapy was explained to them, and TF-CBT works in a parallel manner where skills that the caregiver is learning, the child is learning as well. So the skills that the child is learning, the non-offending caregiver who is accompanying the child is learning exactly the same way. So the same thing. So this particular slide demonstrates the child sessions, the caregiver sessions, and also the conjoined sessions that begin to happen right when treatment begins. This particular slide shows you the practice components, and the practice components, practice is an acronym that is very helpful to understand the progression and the specific skills that are introduced and practiced and reinforced through treatment with youth and their non-offending caregiver. So if you look at the first third of treatment, those are the PRAC components, PRAC. It includes psychoeducation and parenting, relaxation, affect expression and modulation, and cognitive coping. That is the first third of treatment, also first phase of treatment that is known as stabilization and application, right, of these very basic skills. The second third of treatment is the trauma narrative and processing, that is the T. It's the second phase of treatment, which is considered to be trauma narrative, trauma narration, and processing. The third of treatment is the third phase, which is integration and consolidation, and is comprised of the following components, which is in vivo mastery, conjoined sessions, and also enhancing safety and future development.
Thank you, Dr. Marquez. To summarize, trauma-focused cognitive behavioral therapy focuses on 3 steps, with 1, the stabilization of child symptoms, 2, cognitive and emotional integration of the trauma experience, and 3, building resilient skills. If you would like to learn more, please visit the TF-CBT website. Thank you for watching.